Hey guys, welcome back to the channel. My name is Mike, and on today's episode, I am going to give you an EMS acronym that every single provider absolutely must know to help determine level of consciousness. Now, if this is your first time here and you're interested in watching more EMS educational videos just like this one, then consider hitting that big red subscribe button and make sure to enable notifications so you don't miss any future content. During the start of the primary assessment, you must determine your patient's level of consciousness. With this information, you're able to actually tell a great deal about the neurological and the physiological status of your patient. Ultimately, you as the provider have to place your patient into one of three gross categories: conscious and not altered, conscious and altered, or finally just unconscious. To begin the process of determining which category to place your patient in, utilize the acronym AVPU. Now, let's jump over onto the computer and explain exactly what AVPU means.
All right, now with AVPU, there's 4 different levels, okay? And this is what is really awesome about this acronym, okay? So the first level is A, or alert, okay? This is going to be someone that is up, they're talking to you, there's, sitting tall and upright, their eyes are opening and closing spontaneously, they're tracking you around the room, they're having a conversation, they might be confused in that conversation, but they're having conversation, they're able to follow commands easily. This is someone who is alert, okay? Now, if they're not alert, okay, they could be one of the next 3 things, okay? If you walk over to them and they're not alert, their eyes are closed, they're slumped over, something like that, and you go, "Hey, buddy, wake up," and you get a response, their eyes open, or they maybe moan and groan, or, some type of response, they are responsive to verbal stimuli, okay? Something that you said is going to arouse them to some form of response to you. Now, say you shout, "Hey, buddy, wake up." That don't work. And you go over and you give them a little shake, or, you pinch their trapezius, or you put pressure against, the upper portion of the eye, or maybe you give them the old sternal rub. And then you finally get only on that, painful stimuli, you get a response. Okay, their eyes open, or they groan, or they moan, or they pull away from you. Something painful gave you that response. So P is going to be they're responsive to painful stimuli. Okay, but if that doesn't even work, you give them the old sternal rub and nothing, they're going to be U for unresponsive. Okay, and this is, of course, where we don't want them. But you can see the A, the V, the P, and the U of AVPU. And remember, alert, eyes are opening and closing spontaneously. They're engaging in, possible conversation. They are, fully able to track you around the room and engage in, your verbal commands. Verbal, their eyes only open when you give them a verbal command. "Hey, dude, wake up! Wake up! Open your eyes!" Or they give you a moan, groan, or some form of response when and only when you shout or call at them. Painful stimuli, only when you give them a painful stimulus do they respond to you. And then U for unresponsive, for absolutely none of that works, and they are just completely unresponsive.
So guys, that's AVPU. Hopefully this helps you guys out the next time you are in your primary assessment. Stay safe out there, and I will see you guys in the next video.